Hello and welcome. My name's Katie Simons of the Holistic Apothic. I'm a clinical PharmD and my practice is as a medical coach and somatic breath worker, as well as facilitator and consultant in the psychedelic space. And today I wanted to offer some perspectives on the topic of psychedelics and medication management strategies. This is a topic that I do a fair amount of consulting on in the psychedelic space. And part of my medical coaching is transformational tapering or medication tapering and helping folks navigate that space. And oftentimes I find that some of the questions around medications in the psychedelic space tend to get a little stickier than perhaps they need to be. And so today I just want to offer a few perspectives that might expand the conversation and allow us to come back to what is a holistic approach that is built on intent. So a common question that I get in this space looks something like this. I have a journey scheduled in a month. I'm on Prozac, Trazodone, and Adderall. Can I do the journey on these meds or do I need to stop any of them? And to many, this seems like a very reasonable question. But when you stop to consider, there's lots of perspectives and expectations embedded in this question. One of those perspectives is that the medications themselves are simply just a barrier to working with medicines, that there's something that needs clearance, that there's something that needs to be managed. In some ways, the way that this question is phrased, they seem to be a side note almost, something that's very simplified down into a medication interaction with medicine. When in reality, these medications are actually a much larger part of the picture for this person's mindset, for their set and setting. These medications are part of this person's history, their healing journey, their current neuroanatomy, and their belief structures. And so when we minimize or kind of brush medications off into this box where they're just an interaction that needs to be managed, we're not always setting these people up, this person up for the success that they're seeking. So I'm really opening this presentation with an invitation for all of us to take a step back to before the medicine, before the journey, the retreat, the medication even, and land back at intent as our foundation for these conversations so that it's supporting us coming alongside folks in establishing where have you been, where are you now, and where are you trying to go? And medications are a big part of that conversation. So I want to present just a couple different lenses to try on and just see how they land for you and the expansive conversation that is medications and in the psychedelic medicine world. The first is that moving from the allopathic Western medicine model that we've all been brought up with into healing with psychedelics is actually a fairly large paradigm shift. And so when you look at the allopathic Western medicine model and how it's built, largely it's you have a problem or symptomatology, and you go looking to an external healer for solutions for your problem. So the solution is external to yourself in this model. It's a treatment-based model in that this external healer assigns you a treatment or a series of treatments that are supposed to help you with your symptoms. Very few treatments within the Western model are actually curative. It's also a model where a lot of the treatments are have a passive coping mechanism, where they're meant to just turn the volume down on symptoms so that they're not something that's getting in the way with daily life. And again, they're basically symptom management. It's also a reductionist model in that everything is boiled down to organ systems and mechanisms and what's going on the cellular level. Everything's very, very boiled down to segregated organ systems. And it's a hierarchical model where there's a provider, an MD or a DO typically at the top. There's ancillary staff, supportive staff underneath them. And where the patient or the person with the symptoms lies in that pyramid is often very much dependent on the beliefs and perspectives of the provider at the top. And so it can be very variable. On the other side of this paradigm, we have healing with psychedelics. And this model is one with an internal healer. There is a knowing that we are all our best and our most appropriate healers. And in that way, what we ask when we come into this space is for transformation that allows an awareness of why suffering is occurring or how best to support moving through symptoms. And in that way, it's a coping mechanism where we're bringing up symptoms as opposed to turning the volume down. We're turning the volume up even sometimes so that we can look at them, move through them, and address the root cause underneath them. It's a holistic model in that it views the human as a whole, the person as a whole. And it's a cooperative model where facilitators and guides, shamans, whoever is serving and holding space in medicine is ideally cooperative in this process and coming up alongside the person who is looking for relief from suffering. So as we think of this as a paradigm shift, we can also think of it as a spectrum. And this allows us to locate ourselves as well as anybody else that we're meeting on the spectrum. And that allows us to open up a conversation about the willingness to shift one's viewpoint. Because oftentimes when we are going from being indoctrinated into the allopathic Western medicine model, we've gone to providers, we've been given medications. When we move into healing with psychedelics, there is an innate ask on the table to shift into a paradigm where you're reclaiming your own healing power and capacity, as well as looking at the root cause of symptomatology. And sometimes both of those things can feel uncomfortable. And so it has to come down to choice and willingness as well in these conversations. And I think some piece that sometimes gets missed is that when there's medications present that a person's taking, we have to determine their history and relationship to them. It's a very important clue in locating them on this spectrum. And so instead of medications being a barrier to psychedelic use here, it really allows us to see where they've come from and where they are now as an integral part of their healing journey. Another lens that I'd like to just bring up is the neuroanatomy of psychiatric medications specifically. And I'll acknowledge here that there's a lot unknown regarding all of the impacts medications have on neuroanatomy. But there are some things that we know. And so some brain changes that we know happen when psychiatric medications are on board are changes in neurotransmitter receptors density, how many receptors are actually present. We know it can cause changes in those receptors' sensitivity to the neurotransmitter. And we know it can change other neurotransmitter levels that are compensatory in the brain. And so there's a lot of words on this slide, but basically what I'm trying to drive at is that when we introduce a psychiatric medication, what the brain does is says, hey, now there's more of this neurotransmitter like serotonin or dopamine, or maybe there's blockage of a receptor. And so we need to move around what receptors are available, how sensitive those receptors are, and what other neurotransmitters are present in the brain. And so those are real changes that happen in the neuroanatomy. And it takes a couple weeks for all that balance and shift to take place. And then on the back end, if medications come off, it can take several weeks to months for these changes to reacclimate when the medication's gone. The other piece of this is that these changes with neurotransmitters and receptors then lead to structural and functional changes in neural pathways. And one that's particularly pertinent to the psychedelic space are the changes that happen in the default mode network. And we know the default mode network is our ruminative neural pathways. It's what is engaged when we're deep in ruminative thought. It's what's thought to be the place of the ego. And so it's very attached to our identity. And we know that psychedelics disrupt the default mode network. And that's one of the mechanisms that we believe help cause increased neuroplasticity with psychedelic use. Well, some psychiatric medications, a lot of antidepressants specifically that interact with serotonin, like SSRIs and SNRIs, actually stabilize the default mode network. They make it more rigid. And so what we end up with is medications and medicines that are actually acting in a counterproductive way in the neuroanatomy of the brain. And so this is just another piece of information to keep in mind when you are working with or with yourself if medications are on board. The last lens that I think sometimes gets missed, that I think is so very important, that I want to just offer to try on is the neuroception of safety. And so when we talk about psychiatric symptoms from a box that takes it out of DSM-5 criteria and diagnoses and moves into what's the nervous system doing with these symptoms, what we end up with is a knowledge that a lot of these symptoms, such as anxiety, depression, dissociation, substance use, impulsivity, compulsion, and others are actually normal nervous system dysregulation symptoms. And so when we are working from that perspective and we're working with folks that have a history of these symptoms or they're on medications for these symptoms, we have to consider their current nervous system state and their neuroception of safety as a piece of their set. And when we know that these medications and symptoms are present, we have to know that those folks are going to potentially need our nervous systems to co-regulate, especially in the psychedelic space, as emotions come up. And I think this is so important and often overlooked because I hear a lot of stories from both folks and facilitators who, the story of I've been off my meds for a couple weeks and I attempted to journey. I had a lot of medicine given to me and I still had no experience. And what's wrong with me? Was I not off my medication long enough? And that's possible. It's possible that the brain just didn't have enough time with only 2 weeks to come back to balance, depending on the medication that was on board. But what also really comes up for me every single time I hear these stories is, did your body feel safe? Did your subconscious feel safe? What was the setting? And I think that when we are in a place where we're coming alongside folks or we're holding space, we have to take this into consideration because it's so very important. So, as we take in all these considerations and we keep them in mind, we come back to our history gathering. And our history gathering really allows us to come to a better understanding of what is this person's healing journey? What's the path that they're on? Where have they been on that path? And how do I come alongside them on their path? And so, questions like, what's this person's history with their medications and their symptoms? How are they emotionally and physically now? What are their belief systems and values? Really help us gather enough information because we know that intent is informed by where we've been. And so we need to have an understanding of this person's path. How long have they been on medications? What's their relationship with them in the past? These are really important pieces of information when we're gathering history to understand this person's path. And then we can continue being curious and gathering more history to say, what's the path of intent forward? So, what's their relationship with their medications and intentions with them moving forward? What's their relationship with the concept of healing? What does that word mean to them? And what do they think their role in it is? What is this person seeking? How are they wanting to feel after this experience? All of these are so important. And what we can see in some of these examples that I'm going to read for you is that this path is twisty and turny and it's different for everybody. And medications and people's relationship with medications can be really big clues as to what twists and turns are going to be present in the story. So in each of these examples, there's embedded different beliefs and values and intents with just these little snippets of information. And with each of these people, their relationship to their medication contains pertinent information as we build our containers. So I'm going to read these off to you with a description of the person, and I just want you to consider what each of these paths may look like and how they may differ. So the top person is a therapist who came to you because someone said psilocybin could help getting them get off their meds. And they say to you, I've been taking antidepressants my whole life and I'm sick of them. I don't think they're doing anything and I'd like to get off of them. The second person is a referral from a therapist of one of their patients who's struggling and isn't finding relief in traditional therapy. And they say to you, I've tried all the meds in the book and they don't work. I'm still miserable and I really just want relief. I take my meds because getting off of them is hell. The third person is someone who signed up for your retreat with a group of their friends who have been to your retreat before. And this person says to you, oh, these meds? Yeah, I need them to sleep. No sleep without them. That's not a big deal, is it? And the bottom person is an elderly person who just received a terminal cancer diagnosis. And their daughter has worked with you before and has sent them to you. And they say to you, I really feel like my meds have helped me. I have no reason to stop them, and I'd really like to have a profound experience. So obviously, we will gather more history and more information from each of these folks, but just consider how much information is already present in these small blurbs. And this brings us to matching tools to the intent, to the path that this person is on. And when we meet people at intent, it allows us the opportunity to really look at what tools match them best. And it really switches the conversation, right? Because most of us, we have the medicines that we may work with, or the containers, the offerings that we have, the services that we provide. And the question is often, do you fit my container? And these questions, this type of history gathering, this coming alongside a person really shifts the conversation and the question to what's going to support you on your path. It expands the conversation, expands the perspective, and we can help our clients have that same expanded perspective when we have it ourselves. And so questions like what medicine or medicines are going to serve you best right now? Not 6 months from now maybe, but are there any that serve you right now? What dose? Are we working with microdoses or macrodoses or maybe something in between? What are we going to do with the medications? What's best for your path? Is it tapering? Is it holding? Can we move through that with certain medications depending on what they are? Or are we continuing the medications? And how does that inform what medicines we work with? What's the timeline? This is a huge one. Everybody is always thinking this timeline should move fairly quickly, right? There's a bit of a rush. But sometimes the timeline is meant to be longer, and that's okay. Setting and facilitator are obviously on this list, and I think they go right back to the neuroception of safety, what feels safe to this person's nervous system. And then obviously non-psychedelic modalities and resources, because we know the psychedelic doesn't do the work for us. So what other pieces of the puzzle are going to be supportive to this person really being able to do their work? And so again, when we start back at an intent, it allows us to expand the conversation around what tools and timeline best support this person's path. And I encourage each of us to really feel into whether we're allowing our containers to be flexible enough to meet the participant's path of intent, because at the end of the day, it's their work. And so here is where I'll talk about medication interactions, which I know everybody wants to hear about. I'm not going to get into specifics in this particular presentation on specific medicines. There will be resources available on my website for that. But some general considerations that I think are very important to go back to is, first, are we dealing with a potential safety concern with combining medications with a medicine? Or are we dealing with efficacy or blunting effects? And so when we go back to safety concerns, really with a lot of these medicines, our safety concerns come back to serotonin events, potentially seizures, as well as cardiovascular stability. Those are some really big ones. That's not all inclusive for all medicines and all medical concerns, but that's some of the big ones at play. And I think it's important to remember that regardless of whether you're working with people who are on medications or have been on medications, you need to have safety plans in place regardless. The other thing I think is really important to remember is that no substance is inherently safe. And there's always some risk that's assumed. And so when we're dealing with medications as well, or medical conditions that could potentially cause even a small safety risk, it's not worth it. It's not worth it. A lot of these interactions that could potentially be deemed unsafe, especially with medicines that cause the release of serotonin like MDMA and 5-MeO, anytime you're dealing with a medication that could potentially interact with that and cause a serotonin event, it's not going to happen in 100% of people. It's going to happen in a small percent of people, and the results are catastrophic. They could end in death. That risk is not worth it. Even if you get away with serving that way 100 times before something bad happens, it's not worth the risk. When we move into the space of potentially decrease in efficacy in medicines or potential blunting effects of medicine, some of the common serotonin medications or gut transit medications can cause blunting effects. And so then the question becomes, can the blunting effect be compensated for with larger doses of medicine? And sometimes the answer is yes, and sometimes the answer is no, that's too risky. And then it goes back to safety. The other thing to consider is that many blunting effects are extremely variable from person to person. And so there needs to be some looseness in how we think about blunting effects because it is very variable based on the person, their history, the medication dose. There's lots of variables there. So I'm going to leave that conversation at that. And if you have questions, you know where to find me. And the last thing I'll bring up is just about medication tapering. And the first piece that I think is so important to remember is that the tapering process off of psychiatric medications is a transformational process all by itself. We are turning the volume back up on lots of sensations, both physical and emotional, that may have not been present potentially for a very long time. That process is transformational all by itself. And it deserves to be taken at a pace that is gentle for the brain and body. And so longer periods of time increase the tolerability, both with withdrawal symptoms and rebound symptoms. I usually shoot for 8 to 12 weeks or longer, depending on the medication and depending on the person, knowing that the pace of a taper is always determined by that person's symptoms and their felt sense as we move through it. Microdosing can be helpful for neuroplasticity and accessing emotions during this process. And so that can be a supportive tool. And other tools are really, really, really necessary that help decompress and regulate the nervous system, whether that is somatic therapies or other modalities. Those are really important as we move through understanding where these symptoms are coming from in the first place and how we meet those parts of self, where they're at. The last piece I'll just mention in here is that if you are tapering or have someone who is tapering a medication in order to have a psychedelic experience, we're now kind of at this place where knowing that a washout period after the medication is off completely of 2 weeks is often now extended up to 6 weeks before we're really seeing an ability to have a full response if there was blunting that was present previously. So that window of time after the medication is off, again, going back to what we know about neuroanatomy changes, needs to be considered as well. So I will leave you there. If you have questions, I'm available through my website or through the email listed. I hope that this presentation was informative and I hope it was well received. If you have questions, please reach out to me. I love to connect with people and I'm happy to chat. Have a good one.